Can you hear me?
Yes, you are audible.
Okay. So a very warm welcome to our 8th webinar in the series, which WHO Regional Office for Southeast Asia is has been organizing with the Indian Institute of Public Health, Professor Dilip Mavlankar, who is the director, and his team. This 8th webinar, total 11 webinars are there. This 8th one is on promoting well-being of children and adolescents during pandemic. You know that this is the time, a very difficult, unprecedented time for everyone. Not only children and adolescents, but everyone. But the children and adolescents are most affected because of their vulnerability, because of their age, because of their development status. So they go through a lot of physical and mental health issues. And I'm very happy today to welcome our panel, Dr. Nazneen Anwar and Dr. Angela De Silva, both from our WHO Regional Office for Southeast Asia. Dr. Nazneen Anwar is the Rich Advisor for Mental Health and Substance Dependence, and Dr. Angela is our Rich Advisor for Nutrition Health for Development. And I'm also happy to welcome Ms. Aditi Mukherjee, who's Policy Engagement Coordinator, the YP Foundation. We always say nothing for adolescents and young people without them. And I think I'm very happy to see that we have young person's perspective also being addressed by Ms. Aditi Mukherjee, who's going to be talking to us about engaging with adolescents and youth for their well-being. And Dr. Nazneen will talk about mental and psychosocial well-being, and Dr. Angela will discuss promoting healthy diet and physical activity. Now, well-being, is not only physical and mental health, but because of the shortage of time, because this webinar is only for 90 minutes, we are addressing a few issues which are related to physical and mental health, diet, physical activity, psychosocial well-being, and how you can engage adolescents and young people in this process. I'd like to also welcome uh, Professor Shyam Pingle. Dr. Dilip Mavlankar could not attend because of certain personal exigency. Dr. Shyam Pingle is representing Dr. Dilip Mavlankar. I would like to, and this whole session will be moderated by Dr. Rajesh Mehta, who is working in my team as a rich advisor for child and adolescent health. I'll now hand it over to Dr. Shyam Pingle to say a few words on behalf of IIPH, and then we move on to hand it over to Dr. Mehta to take forward this session.
Thank you, Dr. Neena. Thank you for the opportunity. At the outset, Professor Mavlankar sends his apologies because he's not able to attend personally, which he has been attending all along. And today I'm representing IIPH. As many of you may be aware, IIPH or Indian Institute of Public Health Gandhinagar is a joint venture, public-private partnership between the Government of Gujarat and Public Health Foundation of India. We do run many courses, full-time courses in public health, like MPH, Masters in Public Health, which is a flagship course. We also have MHA, Masters in Health Administration, Hospital Administration, and we run diploma courses in occupational health and public health physicians from government, Gujarat government and other governments. And we also have a strong research portfolio, and we are very happy that we are hosting with WHO-SEARO region.
Dr. Shyam, your voice is breaking. Is it me only who's not able to hear, or others are also not able to hear you?
Ma'am, it's clear.
Fine with us.
Yeah. So We're happy with this series of Learn webinars, and 7 are over, and today we are on to the 8th and very important webinar. So without taking much further time, I'll hand it over to Dr. Rajesh Mehta for further proceedings to coordinate. Thank you.
So thank you, Dr. Shyam Pingle and Dr. Nina Raina. So as has been introduced, that this particular webinar is on promoting well-being of children and adolescents during this pandemic. And this whole series has been woven around these important issues. This is the 8th one. And we have earlier also addressed some issues related to children and adolescents, covering both the direct effects and the indirect effects. So we have earlier learned that although there are too many cases in the world of this new infection, more than 35 million new cases globally, out of which 21%, around 7.3 million this week in our region. This is the cumulative number of cases of COVID infection, and more than 1 million deaths in the world. Of course, in our region, the impact is a little less. It's 12% deaths among the global deaths, but still a large number, 7 million cases happening in our region, and some countries having more infections than others. So therefore, earlier also we found that we were told that children and adolescents are directly infected only in a minority numbers. So maybe 1% to 8% or 9% is the range where children and adolescent age group up to 19 years infections are being reported. But there are multiple indirect effects, and we have covered some of them last time, like adolescent sexual reproductive health. We also covered violence against the girls and women, and boys. So we have covered some of them. So today's series we have experts to tell us a little more about these areas. And as we know, the health systems are stretched, they are overstretched. So some services are at risk of disruption or interruption and modification by the governments. So therefore, self-care becomes very important. So the self-care of children, adolescents, through their parents, through their families. So we hope to hear some of that from our experts today, that how do we help communities to engage and take care of themselves. So information is the first step. So awareness and information. So we also hope to listen from experts today that what information is available and can be given to people to take care of themselves. And therefore, the two topics what Dr. Anna said are the mental and psychosocial well-being of children and adolescents. And the other focus today is nutrition, in which diet and physical activity have been chosen for today's webinar. The third important area which we will cover is how do we engage with young people, adolescents, beyond the tokenism. Many times the programs and the people engage with adolescents just by asking them a few questions, or maybe doing a survey. What do you want? What is your need? That's all. But that's for me, if you invite them for a meeting and just talk to them for a while the program has a life of 20 years, it doesn't mean anything. It's just tokenism. So we will hear from one of the experts today on how to actually engage adolescents and young people with more depth, with more meaning and more value from them. So with this, it's my pleasure to invite the first speaker, and the expert is Dr. Nazneen Anwar, who is the regional advisor for mental health and substance use in WHO Southeast Asia Regional Office, and she will be speaking for 15 minutes on promoting the mental and psychosocial well-being of children and adolescents. So over to Nazneen Anwar, please. She is coming up. There is a request to the audience. There are 212 people connected. If you can already start writing your questions in the question box, which can be taken at the end of the three presentations all together. So please write your questions in the question answer box for each presenter. First, we are listening to Dr. Nazneen Anwar. Thank you.
Thank you, Dr. Rajesh, and my pleasure to be here to be able to share some of our experiences, tools, and guidelines that we already have and the challenges that we are facing in this area. So good afternoon to all, and I would like to start my presentation if I can have it, please. So here today I'll be talking about a child and adolescent mental health and how and what we can do to ensure that we can promote mental health and psychosocial well-being. Childhood and adolescence is a stage of vulnerability, and worldwide almost 10 to 20% of children and adolescents experience mental health conditions, and half of this illness begins by the age of 14. And in our region, we've seen that neuropsychiatric conditions are the leading cause of disability for young people. Next slide, please. So what happens if we do not treat these conditions? We will see that there will be developmental issues, a failure in educational fulfillment of the educational attainments, and also failure to achieve their potential to live a productive lives. Children with mental disorders also face major challenges, which are like stigma, isolation, discrimination, and they also, especially in Southeast Asia region, there's a lack of access to healthcare and education facilities. And this definitely is a violation of the fundamental human rights. Next slide, please. So what has this COVID-19 pandemic done to increase the challenges that we already have for children and adolescent mental health? Like all other sections of the population, this vulnerable population has experienced unprecedented interruptions in the daily lives. And these disruptions, because this is the formative years for them, can cause them stress-related problems like anxiety and depression, which can eventually lead to their long life implications for these children. So it is important for us to see how well we can support this group. Next slide, please. Here is age distribution of confirmed COVID-19 cases. And if you look at the age group, we can see that 0 to 4, 5 to 14, 15 to 24, maybe the percentage wise, it is not very high, but the implications here, as I already mentioned, would be a lifelong implication for which we need to give attention to this group. Next slide, please. So even before the COVID pandemic, WHO Southeast Asia region had taken into cognizance this hidden epidemic for children and adolescents. And in 2017, we came out with a publication to look at the mental health status of adolescents in Southeast Asia region. And we generated some data which would be helpful in taking informed action in this area. Next slide, please. Also, mental health and substance use disorders are the largest contributors to the regional burden of disease, 6%. And in Southeast Asia region, suicide is the second most common cause of mortality among this productive age group of 15 to 29 years. So mental health problem is a huge public health problem and also a developmental challenge for us. And we also have to remember that these conditions like depression, anxiety may lead to behavioral problems such as tobacco, alcohol, and drug use. Next slide, please. But these mental health conditions for children and adolescents most of the time goes undiagnosed and hence untreated. There are many reasons for this, one being the stigma attached to it, and also the lack of services available for this group to access. So parents, caregivers are in a constant state of denial that their child or young adult in their family have any mental health conditions. So the stigma attached to it has been a challenge. Even when services have been made available, it is not available. So that's a huge challenge for us. Next slide, please. So if you take the COVID pandemic situation, what has affected them mainly? This home confinement, which can have a lingering psychological impact on these children. Also, when the parents are in isolation and they are separated from the parents, that also causes anxiety, depression, and in some cases, we have also seen suicidal tendency. And the learning gap is widening between children of high and low income because due to the lack of their accessibility to online classes. Child abuse, domestic violence, all these have increased during this time. Either you have a very happy environment while you are locked down, or maybe issues come up. Even the parents, when they are so stressed out, this has affected them as well. So that can also go and be transferred to the children. So that is what we have to look out for as well. Next slide, please. So what are the different psychological distress signs in children? Many of these signs we are all very much aware of. Some are new to us, but we need to look out for these signs and make available for the children the support that they require. Next slide, please. Like I was saying, that it will have a long-term consequences on the children, which could be mental illness and problem in personality development. We also have to remember that how the children and the young adults are feeling right now is actually a very normal thing to happen. We are all very frightened. This is such an uncertain time for all. But what we also have to take care is that children and adolescents are at such an age that they need a lot of support from us. And those caregivers and the community have to take that into cognizance. Next slide, please. So developmental issues could be cognitive developmental issues, socio-emotional developmental issue, and we also have seen health risks of excessive screen time or gaming. And this will lead to gaming disorder, something that has come up, and we at WHO are really taking this very seriously and coming up with different guidelines for gaming disorders. Next slide, please. And we cannot forget children with disabilities. Any child or adolescent with pre-existing mental health and physical disability are at most risk. Challenges of online learning with lack of recreational activities can be frustrating for these children, and also children with autism spectrum disorders who are so used to having their routines, and when these routines are not there, they become anxious, restless, and this is where the caregivers have to take attention to them. Next slide, please. This is WHO guideline on helping children cope with stress during the pandemic. This is not different from any other emergency situation where these guidelines would be followed. I will not go through it, but I just wanted to bring this and present it so that those of us who are not aware could look this up. Next slide, please. This shows in simple terms what we are supposed to do. And one thing is parenting. Parenting with quality time. What can you do? Even though this pandemic has been such an issue of concern for all of us, brought us so many challenges, losing of loved ones, But on the hindsight, let us also look that this has given us an opportunity to come up with bindings with families, with the children who we never had time to sit down and talk to. So this is the time to listen to them, to look at them, and also to give them your full attention. And that is what actually psychosocial support is. Sometimes people think, even I have heard many asking me about psychological and psychosocial support and mental well-being. These are so interrelated. These are just simple things, giving messages, spending time, making them feel good, sharing with them. These are all things that you can do to improve and promote psychosocial well-being. Next slide, please.
So Dr. Nazneen, you will have to expedite a little bit.
Yeah, how much time do I have?
3 more minutes, please.
Okay, so I will just indulge in this one and then I will go very quickly on the other ones. So this storybook, many of you have gone through this and have seen this. This storybook tells everything about what psychosocial support you can give to your children and how to give it. And that child, you will read this book to the child and you will find that every aspect required to provide psychosocial support has been told in a beautiful story in this one. Next slide, please. I really wanted to show this one page from that book, which shows how the child, with care, just look at the expression in their faces, how they feel. And this is psychological support mother is providing to the child. Next slide, please. I like this because it tells us to remember in simple terms, to reassure your child, empower them, maintain your calm, engage them in activities, manage their emotions, educate. Next slide, please. I know I'm going beyond my time, so I will just go through the next slides. So for parents and caregivers, I've already said, next slide. For adolescents, they need to stay connected. And this is the mental health psychosocial support, what WHO-SEARO has developed. Next, please. For addiction, this is what we have. Next, please. For alcohol management, these are tools. Next slide, please. For gaming disorder, next slide, please. These are some of the multimedia content on target issues that is required. Next slide, please. For parents and caregivers, I've always said what they have to do, but I feel they have to be very patient during this time. We'll move on to the next slide, please. And this is mental health and psychosocial consideration, a WHO guideline, and I would really recommend for all to look at it. It has communication materials for every age group. Next slide, please. And this is to address mental health and psychosocial aspects of COVID. Please do have a look at this as well. Next slide, please. And this, everybody knows the pyramid of psychosocial support. And I thought my presentation must bring this in. Next slide, please. And we should not forget the essential health services along with any other service that we give. And I would say end my presentation here and thank you very much.
So thank you, Dr. Nazneen Anwar. Sorry, we had to rush you a little bit because of interest in question answer session later, and we will have opportunities to discuss a little more. But I am so happy to see your slides since you were able to highlight to us that in this age group, there is already a pre-existing burden of issues and disorders of substance use, mental health, suicides. But this gets exaggerated during pandemic. That's a very good message you gave us. And then also suggested to us the approaches. And there are quite a technical resources which you rushed through in your last few slides. The technical resources from WHO and other agencies, which are directed to the children themselves, useful for parents and useful for service providers. So all these slides will be made available to people who are registered to this webinar, and therefore they will have opportunity to have all of this, and they will also get the recording of this webinar too. So I hope the audience, which is 234 at this time, would be writing their questions in the question answer box for Dr. Nazneen, and we shall try to accommodate many of them at the end of the 3 presentations. So my pleasure now to invite the second expert for today's webinar, Dr. Angela De Silva. She is the Regional Advisor for Nutrition and Health Development in WHO Southeast Asia Regional Office. And she has been requested to speak today on promoting healthy diet and physical activity among children and adolescents during this strange period of COVID pandemic. Over to you, Dr. Angela.
Thank you very much, Rajesh, and the organizers for inviting me to talk about promoting healthy diet and physical activity for children and adolescents. Next slide, please. So before I get into the discussion of how COVID has affected the diet and nutrition of children, I thought I will show you some information which shows that we already had a significant problem of malnutrition even before COVID. So this slide actually shows the status of nutrition in children in the region, different overall across the region as of early 2020. So the first figure is showing stunting, wasting, and overweight in children under 5 years of age. You can see that 52 million children are stunted, approximately 24 million are wasted, and 5 million approximately are overweight. And then I pulled out some description of overweight in children to show how overweight is also a significant problem in the region. So under 5, there's 5 million. But as the children get older, 5 to 10 years, there's the school-age children and the adolescents, the overweight figures go up. And you can see that older children, 10 to 19-year-olds, there are about 25 million children who are currently overweight in the region. And this is before the COVID pandemic started. Next slide, please. This is actually a trend graph which shows the nutritional status and how it has performed across the years for SEARO region. And the first figure shows, I don't know whether you can see me pointing. The first figure shows children under 5, and you can see that the stunting levels have come down quite dramatically and then slowly starting to level off. Wasting, we don't have a trend for wasting, but you can see that overweight levels are slowly going up in under 5. Whereas reflecting the previous slide I showed you and the information, you can see that for children 5 to 9 years of age, wasting still remains a significant problem, or thinness, I should say. Overweight is going up significantly and quite worryingly, and similarly in children aged 10 to 19 years. You can see that thinness is a problem in about 20% of children in the region, whereas overweight keeps on going up. And at the moment, there are about 8 to 9% of children who are overweight in the region. One point I like to make here for children between 5 to 9 years of age especially is that we have a huge lack of data, and these are estimates. And because they are estimates and they are not national survey data per se, some of the estimates are probably overestimating the overweight levels. So you can see that in the 5 to 9 group, which has the least amount of data, the overweight trend seems to be quite significant and marked. Next slide, please. And this slide is showing dietary intakes of children, very young children, trends in exclusive breastfeeding. You can see that breastfeeding rates were high, going up in every country. The 6-month exclusive breastfeeding rate was markedly improving in most countries. And you can see that the percentage of children who are receiving appropriate feeding, that's a 6 to 23 months, is also poor in some countries, but also somewhat okay in a couple of countries. So the situation of nutrition in the region was a problem, a significant problem, even before the COVID pandemic. I pulled out one country's information on the kind of foods provided to children aged 6 to 59 months, because we are talking about healthy diets here. And you can see that in that cohort, 75% of the children were fed sweet foods, Sugar sweetened beverages were given to 21%, and these are children under 5 years of age. Tea was given to 44%, whereas you can see eggs, meat, legumes, and nuts are not too bad, 73%, but meat and fish or eggs are given to very small numbers. So we can see that feeding practices were poor, and children were getting, they were not receiving appropriate feeding for their ages even before COVID started. Next slide, please. And also, I'm just showing you some evidence of the dietary environment, which is showing a very unhealthy dietary environment. This is just evidence from 2 countries. Well, the top one is from Bangladesh, which is showing the price of sugar sweetened beverages and how it has reduced across the years in Bangladesh. And the red line is for sugar sweetened beverages, the soft drinks, and the blue line is for carbonates. The other one is for juices, and you can see that all these unhealthy beverages or sugary beverages have become much more affordable to the public over the years from 2004 to 2018. This figure, I hope you can see it, is showing the volume of advertisements on high fat, sugar, and salt products on media during a 1-month period in India. And it's very alarming that most of the 90% or so of the advertisements are confectioneries and bakery items, and also for fast food outlets. And these are what children are exposed to day in and day out over a long period of time. So basically, before the pandemic, we had a unhealthy dietary environment, significantly unhealthy dietary environment across the region. This is just 2 examples from countries, as well as poor nutrition status in terms of all forms of malnutrition. Next slide, please. Physical activity in children also does not show a very good picture. The table here is showing the percentage of children. This is taken from the global school health surveys of 13 to 17-year-olds. And we can see that for the different countries, Bangladesh, India, Indonesia, Myanmar, Sri Lanka, Thailand, and Timor-Leste, the number of children who are physically not active for at least 60 minutes a day are 25% quarter of the population of Bangladesh, almost a third of the population of children of this age in India, Indonesia, a huge number in Myanmar, Thailand also, as well as Timor-Leste. And you can see the screen time in many of the children in the region is fair. So many children spend more than 3 hours watching TV and playing computer games. And many also do not attend physical activity classes. And altogether, the data shows that if you take adolescents, this is showing 13 to 17-year-olds, but if you take adolescent data, about 76% of the adolescents in the region do not receive adequate physical activity. And we know that being physically active at least for 60 minutes a day is very important for both physical and mental well-being of children, as you heard from the previous speaker. Next slide, please. So these, both malnutrition and inadequate physical activity, were significant health problems in the region from long ago, not just right now. So stunting, wasting and thinness, anemia, micronutrient deficiencies, overweight and obesity were all either in single or combined forms affecting children in the region. Next slide, please. Now, what is the effect of COVID? COVID is projected to have a significant effect on food intakes and diets of people, both adults and children. I don't have regional data, but this is just an illustrative example to show you that projected data from FAO show that in 2020, 132 million may go hungry, and of that 36 million are children. This graph is showing the projected rate of undernourishment of children at different scenarios of effect of COVID. So you can see that the best case scenario is also showing a rise. Sorry, this is the pre-COVID scenario in yellow, which is also showing a rise in undernourished children due to various reasons, climate change, various other issues. But with COVID, you can see that there's this even bigger rise in the number of undernourished. Now, in addition, because of COVID, 370 million children are estimated to miss out on nutritious school meals. And this is globally, remember. So in our region, this will be a significant proportion of these people. These children and adults will be in WHO Southeast Asia region, considering the number of population and the socioeconomic circumstances of people in the region. Next slide, please. So if we look at the pandemic, there are very little information about direct effects. As what I mean is that if you take infection rates, they are not that high in children, and children are not significantly affected by the pandemic as far as the evidence shows at the moment. But it is an indirect effect which are very serious and have serious repercussions on future health and also on the nutrition and diets. So restriction of mobility and physical activity, closure of schools, adequate or no access to the routine health care, disruption of economic insecurities, and less access to healthier diets. These have all been seen in different countries, and these have led to many issues. Chief one being the lack of access to health and nutrition care and services, and reduced coverage of the essential nutrition interventions. So things like antenatal care and maternal nutrition, breastfeeding and complementary feeding support, growth monitoring and promotion activities, treatment for severe acute malnutrition, programs which are providing supplementary food, micronutrients such as vitamin A deficiency, disorder prevention programs, nutrition sensitive social protection, all of these are affected. Then if you take school feeding programs halted or disrupted in many countries. And what we need to remember is that school feeding programs usually target the most vulnerable. So the most vulnerable are more affected by all these issues. Instead, children have increased screen time, restricted opportunities for physical activity, they're socially isolated, and this part Nazneen spoke about earlier, so you now understand that this is a huge problem for children. Economic hardship, one major issue, has caused food insecurity, restricted access to healthy foods. Also, there's been reduced access to clean water and sanitation. So all these together have a huge impact on the nutrition and nutrition status of children in the region, and also it has affected their dietary consumptions. Now, one point that I want to really emphasize here is the fact that we're talking about healthy diets. Now, there's a common misunderstanding sometimes that healthy diets are only those that prevent overweight and obesity or NCD-related risk factors, but this is not so. If you look at the WHO definition for healthy diet, it very clearly includes breastfeeding, appropriate complementary feeding, age-specific nutrition for all ages. So it both undernutrition and overnutrition. In fact, all forms of malnutrition can be prevented by consuming a healthy diet. So healthy diet does not mean just a reduction of salt, sugar, and fat. So the COVID pandemic and its effects have affected dietary intakes in children through all these mechanisms, both through health services, the counseling part of health care services, the school feeding programs, economic hardship. These have all created this issue where there's poor access to healthy diets. Next slide, please. So other possible effects of pandemic on food environments include increased availability and accessibility of low-cost, nutrient-poor, processed packaged foods which are high in sugar, salt, and fat. These are much more available compared to fresh vegetables and fruit, and sometimes cheaper too. So children can access these much easier. There's also aggressive marketing of such foods by industry, and this has not reduced during the pandemic. In fact, because of the increased screen time that children spend watching television, they may be more affected or exposed to a lot more marketing, though there's no strong evidence. This is just conjecture. There is also the possibility that governments, because of economic issues and economic and industry effects, may delay or deregulate some recommended population-based interventions such as sugar taxation, which needs to be advocated to continue. On the other hand, there are also some new opportunities, as we have seen. Like, for example, some governments have increased taxation on unhealthy diets, and Maldives is a good example where they have brought in taxation on high salt, sugar, fat foods. The other is that because pandemic risk factors include obesity and NCDs, there's a lot more information out on healthier diets, as well as attention by people on eating healthier diet, but that is more towards the overweight obesity side, whereas the undernutrition affects the very poor and vulnerable, and they are severely affected by the food environment, as in the restricted and availability of foods and the affordability of foods. So it affects both sides, both the overweight and obesity, as well as the undernutrition and the stunting and the wasting. So both the poorer and the more vulnerable children, as well as the other children. Next slide, please.
Dr. Angela, may I request you to expedite, please? 3 minutes.
Yeah. How much time do I have?
3 minutes more.
Okay. So the effects on nutrition programs. This is a UNICEF data that I got just to illustrate some of the effects on nutrition programs in South Asian countries. So we can see that if you take early detection of wasting, there's a 10% drop reported by one country, 75 to 100% drop reported by two countries, and so on. Food subsidies, there's no information. IFA supplementation for adolescent girls. This is something I would like to highlight. Because of school closures, you can see that there's a 50 to 74% drop reported by one country, and 75 to 100% drop reported by 4 countries. So this is just an example of some of the programs that are affected by the COVID pandemic, and therefore how nutrition status is affected in children. Next slide, please. Same, nutrition programs such as school feeding programs are affected. Nutrition support for pregnant and lactating mothers are affected. Promotion of nutrition and safe diets for children are affected. All these are affected in multiple countries, as we can see from this data. Next slide, please. Okay, these are another example of the violations of IMS code reported during the pandemic. We can see that many countries have reported different types of violation during the pandemic. Okay, next slide, please. So what are the conclusions, and what can we do? So one major issue is information. We do not have enough information, and we need to continue monitoring and gathering data and carrying out situation analysis, which would inform different programs and decisions on different programs. So this is one important fact that we need to take note of. Food security and social protection for at-risk populations. So food security interventions are very important, and enhanced social protection in terms of payments, food subsidies, ensuring nutrition content of diet, and preventing distribution of high calorie, low nutrient products needs to be supported. Then access to healthcare, either through standard means or when standard means are not possible, through innovative different means such as using community health workers, telehealth, and so on, can actually go a long way towards mitigating these effects on children. Next slide, please. School feeding is one major aspect. Countries need to have contingency plans for the distribution of meals, maybe through provision of rations or increasing social protection. Then informal institutions such as women's and community support groups can deliver health education when feasible, and alternative opportunities for children to engage in physical activity need to be promoted and are very important. Same way, a healthy food environment. So we have to continue to advocate with governments to support population-based interventions and through regulations as well as legislation. Next slide, please. So in order to safeguard the health and nutrition of children during this COVID pandemic and to promote healthy diets in children, we need to take very specific actions where we have to be the actions need to be based on data, as I showed earlier. The actions have to be context specific and based on some evidence of best practices. So it's good to share information across countries on the different practices. And governments and development partners, we need to re-strategize and reprioritize investments using data. And these are very important in the aspect of ensuring that children receive proper nutrition and supported to consume healthier diets. Thank you.
Thank you. Thank you, Dr. Angela. And these are the sources. Very nice. So thank you so much for highlighting that there already has been triple burden of nutrition in the region before the pandemic came. And the food environment was already worsening before the pandemic. But certainly, as you pointed out, these are getting exaggerated, these deficiencies. So there is clear risk of immediate health and nutrition issues, but also long-term effects, as you mentioned.
Yes.
These might have during the life course. But you also highlighted that there could be an opportunity that governments look at this as a ability to have new policies and laws to protect nutrition going forward. So therefore, with more data and information, we could look forward to build back better, which is for health system and nutrition systems and education systems would be a very great idea that we use this pandemic. So thank you so much. And we will share these slides with your permission with the audience. So therefore, my next job is to look at how the young people themselves, the adolescents and young peoples can be engaged in building back better. How do we make them understand? How do we make them contribute not only to their own well-being and health, but also contributing to the society, to the community, using the resources which the society and governments can provide them. So we have an expert, young person, Aditi Mukherjee, who is the coordinator for engagement and policy for young people through the Young People Foundation. The Young People Foundation actually for about 20 years has been working with adolescents and young people in the area of health and in other areas which affect the young people in India. And recently we have collaborated with them to set up regional youth networks in the Southeast Asia region. And they will be helping us with their experience of a national network in India to set up and build capacity of the youth networks in the other Southeast Asia region countries. So very soon we will have networks of youth connected together, working for the adolescent health programs and other programs in a multi-sectoral environment. So we are happy to receive today some information and the way forward from Aditi Mukherjee. Over to you, Aditi, to tell us how to do better engagement with young people. Thank you.
Thank you, Dr. Mehta, and thank you to the WHO-SEARO office and the Indian Institute of Public Health for having me. As mentioned, my name is Aditi, and I'm the Policy Engagement Coordinator for the YP Foundation. Today, I'm hoping to shed some insight on how the COVID-25 pandemic has affected adolescents and young people, and how we at YP have engaged with them to ensure their well-being and the well-being of their communities. Next slide, please. So as Dr. Mehta mentioned, the adolescents and young people are considered safe populations, and the impact on their health and well-being and their environments has been largely unexamined. In our work with these groups, we found that there has been significant impact on their physical health, their mental well-being, their access to information about the pandemic itself, their livelihoods, and their access to essential commodities, services, and education. However, these have not been well documented, at least in India, with respect to government service. So we found that access to education, since it now depends on adolescents and young people having access to the internet, it is hugely gendered, and its usage is still gendered, and this has cost many girls their education, with their families either closely monitoring their usage or stopping them from accessing it completely. There has also been a noticeable uptick in gender-based violence as more adolescents are forced into marriage and more young people experience sexual and gender-based violence. There has also been an uptick in adolescents experiencing violence at home and also witnessing their family members perpetrating violence. Next slide, please. The impact most visible for young people has been the loss of employment and livelihood, which has primarily been the focus of government relief programs. Over 4 million people, young people in India, have lost their source of income during the pandemic and the ensuing lockdown, with sectors like agriculture and construction being the worst affected. This, coupled with the already high unemployment rate for young people in the region as compared to older adults, has raised concern about their return to the workforce, and this has primarily been the focus of the government's efforts towards relief work for young people. The ramifications of these events, of both the pandemic and the lockdown, on the group's mental health is evident. In our own work, we found that the restriction on the movement and the isolation from peer groups have added to mental stress. This increases for young people and adolescents from marginalized communities in particular. Next slide, please. So today I would like to talk to you about the elements we must ensure in our policies and our interventions to allow for the meaningful and effective engagement of adolescents and young people. The first of which is the recognition of diversity. Both of these groups have internal diversities. We are heterogeneous groups, and it is important for us to recognize that in our efforts going forward. The second element is the need for long-term commitment, not just stopping it at seeking input, as Dr. Mehta mentioned. And our interactions cannot be limited to just asking them about their lived realities and then not allowing them the space to participate in our intervention more. The third element is the oft-cited nothing for us without us. So any intervention, policy, or platform which seeks to benefit young people or adolescents has to involve them. The fourth and final element is the encouragement for youth leadership. So this goes beyond just participation and asking young people to actually head interventions as opposed to just being passive beneficiaries. Next slide, please. So the first element, which was the recognition that young people and adolescents are diverse groups, it is necessary that we recognize that there is no one-size-fits-all solution to the problems faced by these groups. Marginalized and vulnerable populations such as LGBTQIA+ and Dalit, indigenous groups, and those with disabilities have seen the worst effects of the pandemic, while being the last to be considered for relief efforts and for monetary incentives. It is essential for us to not only recognize these differences, but also to ensure that in our platforms and our interventions, we create space specifically for these groups. It isn't enough just to recognize difference. It's also on us as people with more privilege to make space for those who don't. Next slide, please. To ensure that these groups are included, we have to ensure that their participation is institutionalized. We also have to recognize that we as people from outside of these groups cannot judge the lived realities of these groups. We must defer to them to explain it to us, what their most urgent needs are and what our interventions must do. This is also the case for implementing the intervention. It is crucial to ensure that these mechanisms also provide a safe and open environment for groups to freely give input and ask for accountability from us. Next slide, please. The second element which I mentioned was a long-term commitment. As Dr. Mehta mentioned, it is not meaningful for young people and adolescents to just be involved at the first stage wherein they're asked for input. That is very tokenistic, unfortunately, and very present in the development sector, unfortunately. Too often the engagement with adolescents and young people is either for just one young person to be present, or for them to just be asked questions about what the problem is and how it affects them, but the actual actioning out of the solution is left to older adults and other stakeholders who do not directly feel the brunt of these issues and therefore cannot judge how well these interventions are performing. Okay. So adolescents and young people must be involved in all steps of an intervention, from ideation to implementation. A commitment cannot be made just for adolescents and young people to be informed at the beginning of an intervention and then not be involved when the interventions have been actually actioned out. And we have to have mechanisms wherein young people and adolescents can ask for accountability. Next slide, please. So nothing for us without us, an oft-cited slogan. So this is just reiterating that young people and adolescents are best suited for examining the issues which affect our lived realities. Policy engagement and implementation can be learned. However, the input about our lives must come from us. Our lived realities cannot be judged by an outside person. So any measure for young people or adolescents has to come from these groups. Next slide, please. In times of crisis, we've seen that young people have taken up the mantle to provide assistance for their communities. And therefore, it is essential that those interventions not just be limited to issues which directly affect adolescents and young people. It is essential that young people are able to influence the platforms and are able to action out the intervention and are able to ask for accountability. If we're envisioning young people and adolescents as future leaders, it's important for us to ensure their inclusion in policy processes and interventions today. Next slide, please. So the final stage of engagement with young people must involve their elevation to leadership. So we've already seen them take up leadership roles and do it well. In times of crisis, we've seen that young people can come through. An example that I can cite from my own work is an initiative started by a member of our own network in Jammu and Kashmir, where the state saw an influx of migrant workers wanting to return home, but could not do so because there was no method of conveyance. So young leaders from rural parts of Jammu and Kashmir set up liaisons with district workers to ensure they were given temporary relief, and are still working with state officials to ensure that migrant workers have the ability to go home and are able to do so safely. So it cannot stop at just young people being participants. We have to elevate them to leadership positions so that we ensure not only sustainable change, but also effective change. Next slide, please. So now I can speak about what the YP Foundation has been working on for the pandemic and the ensuing lockdown. So the YP Foundation has, as Dr. Mehta mentioned, we've worked with adolescents and young people for more than 2 decades. We have cohorts of programmatic intervention and we work through those in UP, Bihar and Rajasthan in India. We also have a nationwide network of young activists, and for after the onset of the lockdown, we realized that we had to quickly reassess how we wanted to proceed, and we knew that this could not just come from us sitting in Delhi. We knew that we needed to conduct a needs assessment, and it had to be led by young people who themselves were facing the brunt of the lockdown. Next slide, please. So we started with conducting a needs assessment survey across 25 states of India and 6 union territories. The insights represented, the insights were from diverse communities of adolescents and youth, including informal laborers, tea plantation laborers, marine fisherfolk, gender and sexual minorities, tribal individuals, sex workers, persons living with HIV, substance abusers, Dalit individuals, school-going children, medical students, and those in alternative care. We ensured that all of these groups had a hand in how the needs assessment survey would be constructed. So it wasn't just us thinking about a tool and then fitting it to these groups. We invited their input into what the tool should look like. We then had FGDs with our programmatic cohorts in Rajasthan, Delhi, UP, and Bihar. And then we worked directly in Delhi, and a fundraising effort was raised for our Delhi cohort, which was facing particular difficulties during the lockdown with respect to their access to essential commodities. We then, through our needs assessment survey, we set up a rapid response mechanism through which we could directly intervene to members of our network and other young people who needed immediate attention. And we're still working with this network and with our programmatic cohort to ensure that their communities are still are still able to manage their way through the lockdown and through the pandemic. So to ensure that our intervention wasn't just a one-time. Next slide, please. As I mentioned, we anchor a nationwide network of young activists through which we did the needs assessment survey. This group comes together with young activists working on a diverse range of issues, from SRHR to disability to migrant workers, and this group was the first for us to consult for the survey. So they are also a crucial part of our rapid response mechanism. Next slide, please. So just as an example, one of the interventions where we were brought in was a member of our network in Odisha asked for our intervention with tribal communities who they had already worked with. The community identified that their supply of sanitation commodities and menstrual health management supplies had come to a complete stop with the lockdown, and they were struggling to get these essential commodities to the community. So we arranged for immediate monetary relief, and then we worked with district officials in Bodh and Bolankir to ensure that this would not happen again. We're still working in this district to ensure that this doesn't happen again and that the supply is smooth and ongoing. Our member, the member of our network is still liaising with both the district and state officials. Next slide, please. So as I mentioned, we have programmatic interventions which focus on UP, Bihar, Rajasthan, and Delhi. And we undertook FGDs and individual interviews with both of these cohorts. And the insights we got from these cohorts was the first and most pressing concern that this cohort mentioned was that there is the dearth of information and awareness about the pandemic itself. So there is a lot of misinformation going around, especially in communities where internet access is low. And we've heard everything from this is the apocalypse and the world is ending, and we've heard that China created this virus, and we've heard that minority communities like Dalit community are responsible for this virus. So information about the pandemic is especially low. We also mapped out the impact on health in these 4 states, and general access to healthcare services has been low, And as there is a shortage of healthcare service delivery points for any non-COVID related issue, and because young people are generally associated as a healthy age group, there is very low focus on their needs. As there is also a dearth of authentic information in regional languages, so the information continues to be in Hindi or English, which young people from states like Nagaland and Lakshadweep and Andaman and Nicobar Islands are not comfortable with, and they're also, and in remote regions like this, they're also fearful of being diagnosed with any illness because there's no conveyance facilities and there's excuse me, poor availability of healthcare facilities. There's also been a significant impact.
Is it time to close now?
Okay, sorry. The full report is available on our website if you'd like to read it. There's been a significant impact in mental health and SRHR, as well as access to education. I'd like to point out the fundraising effort that we did for our Delhi cohort. So we've been working in the Sundar Nagar nursery area in Delhi for over a decade. We've implemented gender justice and empowerment programs for adolescent girls. In June, the community, which is primarily made up of construction workers and daily wage workers, was not able to access essential supplies, and we raised money for them to ensure that we first did an assessment with our cohort from the community, and then we were able to raise money for about 100 families. In conclusion, I would just like to reiterate that any intervention that we devise for COVID relief efforts or any other efforts, we must first involve the beneficiaries themselves. An intervention cannot be devised from the outside in, it has to come from the beneficiaries themselves. So thank you very much for listening to me. And thank you to WHO and to the Indian Institute of Public Health for having me. Thank you.
Thank you, Aditi. Thank you for bringing the voice of adolescents to us. So you are correct when you pointed out that adolescents, which is 10 to 19, and the youth groups, which is 20 to 24, both of them have a lot of diversity in their context, in their situation. Their needs are different, and their languages diversify them. So there are a lot of diversity in this age group. And you made a strong case of involving and engaging adolescents and youth in the whole life cycle of the program, from planning to implementation. And also you said it is important to involve them in monitoring and accountability. So can adolescents ask about the benefits of the program which have not happened or which were to happen? So that's a good advice and advocacy you are doing, that keep them engaged throughout the program cycle. And nothing for them without them. That's a good slogan to follow. And you were able to give some illustrations from your own work of, for example, bringing in the felt need of menstrual support for people who are outside India. The government of India has a big program of supplying free of cost or subsidized menstrual pads for girls across the country for menstrual management. And that supply chain may have got affected during the pandemic and lockdown. So therefore, the Young People Foundation brought this to fore, immediately supplied, and then ensured that supply chain is not interrupted again. And then food supply and the essentials sometimes you have to provide for. So thank you for all that experience. So we look forward to continue to work with you. So thanks to all speakers. There are some questions which we want to take now. So can we start from the first one, which is related to the first presentation? It says that there is an issue of mental health because of people are at home. These adolescents, the students are at home because of school closure, and therefore, Dr. Nazneen, if there is a domestic violence happening in those families, and these young people are exposed to that because they are not in school, they're always at home. So what mental health issues can emerge and how can we help? So and within this, maybe you can accommodate the next question, which is about if the services are not are getting interrupted. Is digital health an option? Can that be used for psychosocial support and providing necessary counseling and help? Is telephonic option available?
Okay. Thank you, Dr. Rajesh, and thanks for these questions. They're interesting questions. And the first question was regarding domestic violence, and this question is asked repeatedly because during domestic violence, people tend to forget that they have children at home. You know, the anger takes more of you. So, but domestic violence do have social and mental health implications on children. And this has been one of the biggest challenges during the lockdown. So what happens to this child? They have social issues and also mental health issues. This sometimes we think that it is just once or twice this has happened, but research shows that this might have a lasting impact on the child if this is not addressed properly and that support not given. Talk to the child, how the child is feeling. So what happens is, for social issues, the child starts not mixing with people, the school grades go down, don't feel like going to school, talks about headaches, stomach aches, or something, or doesn't eat properly. So caretaker or the parents have to look into this. If the child might not always say that this has how the child is feeling because they cannot express themselves. But also in the long run, we see that these kind of children, if no support has been given, they lose empathy for others as well. They think this is the right thing to do. And so there are many issues that come up with domestic violence and why children should not be subjected to witness domestic violence. So what can we do? We can do is, this is also a kind of counseling that is required. If some children will not be affected, you know, each children responds to a condition differently, a situation differently. So some children might just take it in the stride and go ahead, but many will be affected. So the caregivers, the children, they need to look into this. If they see any change in the behavior of the child, to sit down with the child, talk, and if required, if they can do the counseling, fine. If not, they can take professional help. So this is what I would advise.
So thank you, Dr. Nazneen. Yeah, sorry, go if you want to go. Please go ahead.
No, I'm done with this answer. I was moving on to the other question that you asked.
Yeah, the next question is also, you know, from a COVID warrior. They remind us that, you know, doctors and nurses, both spouses may be on duty in these times. And if there is a 8-year-old child at home who is left alone, how do we help that child who is suddenly feeling very lonely and unattended? Are there self-help resources available on our website or other websites where such help could be obtained?
For an 8-year-old child, we usually do not have that kind of self-help because they need guided help. No? So what in this condition, what caregiver or parent who has no other way but to leave the child alone must look into their own calmness, their own understanding of the situation, because the children do overhear and they worry about their parents being affected, going out, maybe the COVID virus will get them, they lose their parents. So many kinds of things play in their minds and they worry about this. They feel lonely, and when a child is depressed or lonely, they want to cling to their parents where they can get some support. So that is also one reason that they feel like this. So the child can be asked to interact with children of his or her age, to talk to them. Even they can go on virtual things like we are doing right now. So, and to see what they like to play and to give time to them is what I would really recommend at this time. Sure. I know it is a difficult time, but each of us will have to see how our child responds to it. Yeah. So it's not one size fits all, but of course there are some things that we have to.
Yeah, sure. So there is not a direct solution available. These are individual circumstances, but these are difficult times. So we have to evolve sometimes our own solutions. But the principles are clear, as you said. Spend more time, keep them busy, some hobby. So parents are aware, so maybe they'll have to evolve something for themselves.
And parents have to give some quality time when they are at home
Quality.
to sit with the child. Parents come home and become busy with the other household chores, but that's not the
Yeah.
way. Just come, sit with the child, and the child explain to the child why they have to go out. I think that would help.
Yeah. So aware parents provide quality time, even if they are themselves tired. It is also important that children get quality time. Thank you for reminding that. So moving on to Dr. Angela, the latest question for you is that during these times you reminded us there is a lot of commercial drive on promoting the food which we consider is unhealthy and the health side. IMS, for example, the infant food industry and the breast milk substitute being promoted. So how do we manage that? How do we resist that?
Okay, so for the IMS Act, of course, I mean, many of the countries have IMS legislation, and it's a matter of implementation of the legislation. What's the issue, or the enforcement of legislation? The issue is that I think the watchdogs and civil society need to be very vigilant during this time, as has happened in India quite often. There are good examples from India where the civil society did take up issues where IMS Act was violated and provided information to the government to take action. So I think all of us at a government level, country level, civil society, and as an individual, we have to sort of support this act and also support these actions at country level. For processed packaged foods, yes. So there are a couple of actions that we have already taken. One is, of course, education of the public. Public are very aware of the issues around salt, sugar, fat, and of course the issues around providing their children with high salt, high sugar, high fat foods. The problem is, of course, economic. So the cost is cheap. Therefore, parents tend to, as you saw in the Nepal, complementary or under 5 children, parents tend to be able to buy these things at low cost just to fill a child's stomach. Maybe it's not nutritious. So in this case, that is why I emphasize a lot on social protection, education and counseling of parents and so on. And of course, the fact that we need to promote legislation. This is a good opportunity for countries to relook or sort of take a stock of where they're going, how they're going, because this epidemic has highlighted, this pandemic has highlighted the issues around NCDs and overweight and obesity. So it's a good time for countries to take stock of these issues and think about how they're going to go forward with legislation, taxation, regulatory action, and not just have the actions, but also to enforce it. And I would like to again mention Maldives here. In the last 2 months, Maldives has brought in this tax on unhealthy foods, which is a good example. They had a taxation on sugar sweetened beverages, but they've expanded it to unhealthy foods. So that is one good example. Of course, we also need to subsidize healthier foods. That's the other flip side. So we can tax unhealthy foods, but what do people eat? So I think as WHO, we need to advocate on these, and as civil societies also need to advocate on these, and program managers need to look at these in a sort of holistic manner, so that not just the taxation part, also the availability of healthier foods. So the food environment as a whole needs to be focused on. Thank you.
Great. So yeah, so we know some of the interventions which work. It is time to bring them back and do even better. So thank you for that advice. So we mentioned that physical activity has reduced. So the question is that during this period, if there has been reduced activity, it was already less, but further reduced. So do you think there is a real risk of NCD happening later on because of this period of inactivity?
So from the evidence so far, we know that obviously if there's low physical activity and increased sedentary behaviors, there is a risk of unhealthy overweight, obesity, and future NCDs. And I don't think that it's going to change at this point. So there are 2 things. One is, of course, this is a fairly short period, so that this period of inactivity may not lead to a huge impact on NCDs. But of course, this kind of inactivity will be habit forming. So in that sense, children will get used to more inactivity, more screen play, and even when we come out of the pandemic, they may continue to do so. So there's always that opportunity, those chances. One other point is that we don't really know enough about this pandemic and how it affects physical activity. That's why the issue of data, collecting data and having a situation analysis is so very important. To we have proper safeguards against this kind of problem. Thank you.
Yeah, sure. So thank you. So there would be a theoretical risk, but it's been luckily short term only because the governments have started opening up now. So possibly it should be possible. But immediate effects are also there, as Dr. Nazneen was pointing out.
Of course,
that
yes.
activity, the physical activity, the exercises is a good way to improve the mental well-being.
Yeah, and
So
also mental health.
right? So stress busting can happen through exercise.
Of course,
So therefore, all of those benefits for immediate life are important. Right.
Definitely.
So thank you for that. And I see the nodding face of Dr. Nazneen. She agrees that we should promote exercises, physical activity in any case for mental well-being also. So there are some wide-ranging questions beyond the scope of this short time, like how do you expand the implementation of National Health Program in India? How do we actually take care of stigma and cultural issues in adolescent health and mental health related areas of work? So those are big things to be discussed. And for example, child abuse services, there is a question I don't think we can answer in short time, that the services were already less in many countries. The social support and the protective services, now they have further, got reduced. So how do we help such unfortunate things which happen as abuse and sex abuse, and the services are kind of strained? So how do we bring out the society together to help each other? So those are big issues, so we can discuss sometimes later. But I will end with one last question to Aditi. People want to know how easy it is to engage with adolescents and young people, or is it difficult? So how do you make it happen?
It's not, it really depends on the context in which you seek their participation. So you have to start somewhere. It'll be difficult in the beginning, granted, but once you're already working with them, it gets easier. So, and right now we have no choice, so we have to do it either way.
So ice breaking may be important, but rapport, once trust is there, rapport is there, I think you guys are doing wonderfully well. I think there is a way to work with adolescents. So we will keep learning from you. So thank you so much. My honor and privilege to thank all the three experts for spending their time with us in these busy days and letting us have a lot of good scientific information and evidence and some of the possible actions which can be taken together. So thank you so much. I hand over now to Dr. Neena Raina for her closing remarks.
Thank you, Rajesh. Thank you for inviting us.
Thank you very much, Dr. Rajesh, for moderating this session and finishing on time. We still have about 4 minutes to finish. And I would like to thank Dr. Nazneen, Dr. Angela, and Dr. Aditi for really making it on time. And I know Dr. Rajesh was interrupting you. And the whole idea was that if we can take some questions, also from audience. So I see, when I was seeing promoting well-being of children and adolescents, and I heard some parents saying, what about well-being of parents? You don't know, when the children and adolescents are at home, every half an hour they come to and say, we are feeling bored. So what do we do? So it's so difficult to keep them engaged and keep them occupied also. So there are, I would say, as I said in the beginning, there are two extremes. One is, adolescents and children who are living in vulnerable environments and difficult situations, which is further, becomes problematic because of poverty, because of domestic violence, because of other risky behaviors, especially if a father is alcoholic and beats up the child or an adolescent at home. So there are issues and there are problems. And I see that, the way these three presentations have been interwoven, there is so much of connectivity between mental well-being and physical well-being, especially, if you are mentally stressed, you end up eating all junk food, or you're overeating, or you're not eating well. So that leads to obesity. And I see a lot of parents and children and adolescents complaining that during the lockdown periods and during this COVID period, when the children are not able to go out to play, they are not able to go to the school, uh, they end up putting on weight. And all they do is have increased screen time and have more, very unhealthy eating habits. So there are issues linked to both, mental status and eating habits and eating unhealthy food. And especially, it is so unfortunate that the food which is unhealthy is more affordable, is cheaper. And I think that's how we always see McDonald's. How McDonald's came into the US was, to really cater to the breakfast needs of people who were relatively poor, because the costs were so down, they could afford it. So healthy foods, I completely agree with Dr. Angela, are not, one, are not easily available, and two, are not affordable by most of the families. And lastly, I would say that, yes, it's very, very important to keep young people, adolescents, engaged and hear their voices and concerns. And I think YT Foundation has done some wonderful work by, interviewing those people and engaging them, because these are very formative years. If you can change their behavior now, you have really produced a very responsible and a good citizen as an adult. And if they can also influence their behavior, you have also, secured a healthy aging. So it's a very, very, it's a life course, and that's why you see these series are webinar series are life course, because one is connected to the other. So we can't de-link one age group from the other age group. And when I was talking on healthy aging webinar, I was saying that the healthy or unhealthy aging trajectory is defined when the baby is still in the womb of the mother. So that's how the aging, also gets defined. So genetics has an important role to play, but the environment and the way diet and physical activity and the mental status, mental well-being has a very important role to play. And we always say mind over body. So I think, hence today, I think we heard that yes, mental well-being is very, very important for somebody to be also be able to be physically healthy, to be able to eat properly, to be able to go out and do some physical activity. These are so much interlinked. And I would definitely, we always say nothing for us without us, but then us has to be also properly engaged. And I'm sure that YP Foundation will bring on board more and more young people and address their needs during these difficult times. Gender plays a very, very important role. I think the schools are shut down, and we are going to have additional 4 webinars, which are not listed here, but soon we will be announcing those additional 4 webinars, which Dr. Mehta will, lead, and we are doing it in collaboration with UNFPA and UNICEF, and that will be on reopening of schools. So how Ministry of Education, Ministry of Health can come together and plan that when you decide to open the schools, you do it in a very responsible way, keeping the safety of these children and adolescent in mind. These are very difficult times for young children who are not able to go to school. because everything is online. They don't have telephones. Their parents are, the father is stuck because he has only one phone. And if there are two siblings, boy and a girl, believe in me, I think Aditi, you raised that issue, that the phone is always taken up by the boy and they always support, and the classes are during the same time. So if both parents have phone, and it's the privilege for many, but it's becoming a necessity and a need for most of the parents to have smartphones, not the regular phones, smartphones, and it's so unaffordable. And I think that's something I heard few people, young people working and collecting smartphones, that in case you want to donate for the school children. So people do donate, they have, because they keep changing phones rather than selling it for 20% of the price. They just donate it to these children. So I think it's a wonderful webinar for the well-being of children and adolescents. And we are talking of from 0 to 19 years of age, and rather 24 years of age, when these people have differing needs, and parenting also is different. So I hope that we'll soon have one webinar for parents. How do you do parenting? Dr. Mehta, kindly note it down, because there's a lot of requests which has been coming to my mind, to me, that why don't you also address on parenting? How do you manage, during these difficult times? Somebody raised the question to Dr. Nasni. If you have an 8-year-old and both of you are working, what do you do? So I think those are the challenges which many parents are also facing, related to keeping them engaged, keeping them healthy, and keeping them sane, so that they don't suffer from mental issues. So with these words, I would like to thank Dr. Angela, Dr. Nazneen, and Ms. Aditi, and more importantly, our IIPH team, Dr. Pingle, and Kalpana and her team, who have really supported this webinar. Technologically, it's been uneventful. I think it's really gone very slow. And to Dr. Mehta for moderating this session, and most importantly, all the participants who have really remained engaged with us until now. Thank you very much. See you during the next webinar on next Wednesday, which is a very interesting one, and on abortion. Please do join.
Bye. Thank you.
Thank you.
Bye.
Thank you, audience.
Thank you. Bye. Ah,